Everyone, thank you so much for joining us. Happy Lunar New Year. Fertility journeys can be complex, emotional, and deeply personal. Whether you are actively trying to conceive, considering your options, or simply interested in learning more, knowing where to start could be very confusing. There are so many fertility trends in the news, and it's hard to know what actually works. So there are the ins and outs. Oh, so what are the ins and outs of fertility for 2025? So we'll find out this by chatting with Dr. Sasha Hakman, a board-certified OBGYN. So during this live, we are going to talk about what Dr. Hakman recommends for fertility support in 2025, including what you should add to your routine and what you should take out. She will explain the role of our mindset in fertility, how plastic disrupts your hormones, becoming an advocate for yourself, and so much more. Here you are. Hello. Hi, Dr. Hackman.
Hello, how are you?
Good. Thank you so much for joining us today.
Thank you for having me here. Excited to talk about all of the different variables that can affect our hormones and fertility.
Yes, I feel like it's almost getting the second reset because today is actually Lunar New Year. So it's like a perfect to have this.
Happy New Year.
Yeah, Happy New Year. Before we start, tell us a little bit about yourself, like how you became a board-certified OBGYN.
Well, I'm actually double board certified in OBGYN and reproductive endocrinology and infertility, which means that after medical school, I did 4 years of OBGYN residency through a Michigan State program in Southfield, Michigan. And then that was followed by an additional 3 years of reproductive endocrinology and infertility fellowship training. Each of those trainings does require 2 exams to become board certified. The first is a written exam, and the next one is an oral exam where you have 3 examiners in 3 different blocks, 2 examiners in 3 different blocks who basically can ask you anything about the specialty, and you have to show proficiency, knowing all the guidelines, make sure that you are essentially giving really good and safe care to patients in both of those specialties.
That is intense.
It is intense. I always tell patients, like, we have as many years of training as a neurosurgeon. So just saying.
Okay. This actually leads to my next question because I think they're related because of your educational or training background. You actually create so much educational content. So what compels you to do that, to share, especially sharing this information with a lay audience?
My biggest motivator, I would say, is that I think that the average woman and even male understands very little about reproduction. When we're in elementary and high school, when you are learning about sex ed, it's all about preventing STDs and preventing pregnancy, but there's really no education on what are the different variables on how to get pregnant, what negatively impacts your chances of conception, what are some red flags, things to look out for, how does female and male age affect likelihood of pregnancy, so that what I end up dealing with in my clinical practice on an almost daily basis is patients often coming in saying, I wish I knew XYZ. This is a very common line that I hear all the time. I wish I knew how age affected my fertility. I would have frozen my eggs. I wish I knew that after trying for this long, there could be something really drastically wrong. I wish I knew that irregular periods meant that it would be very difficult to conceive naturally and that there was a relatively easy fix to it. So there's always, I wish I knew, I wish I knew. So that is really my biggest motivator, to go out there and say, hey, here are the things that everybody should know, both men and women alike, because it does take 2 to make a baby.
Yeah. And then people really need to know this information before conception to prep for the conception.
Yes. And I think that, you know, there is a big lack also on reproductive education for instance, people who have circumstantial infertility. So that could be, you're single, you're hoping to find a partner, you really would like to have a child, but you're on this journey alone. What are your options? Or same-sex couples, whether it's female and male couples, sometimes there's for instance, with the same-sex female couples, an assumption that, well, there's two of us that can contribute eggs. This should be relatively easy as long as we get a sperm donor, which isn't always the case. Or for a lot of the either single men who are looking to, become fathers, or same-sex male couples where they lack understanding of the process of essentially having their own biological children. So yeah, there's definitely a need for more education for all walks of life.
There's so much to it.
So much to it.
So today we're gonna discuss a post that you shared, like called "Fertility Ins and Out for 2025." So before diving, like, what prompted you to make this post?
Honestly, it was trending, and you know how it works with our generation, millennials, Gen Zers. You gotta follow the trends, and if that is what helps to educate people about what are important things to think about for not only their overall health but their reproductive health, then I'm all about it. So
Okay, let's like diving, like start with the outs, because I feel like we want to leave people with some like positive stuff happening. So like since it's something that many of us might be doing, and then switching to the inks, so people feel better about it. So like when you mention like waiting too long, uh, whatever that means to you, expand for us.
yeah, waiting too long can mean a lot of things. In my practice, I would say the most common scenario of waiting too long is women coming in their 40s now for the first time exploring what their fertility options are. And I post about this probably more than anything because I just wish every woman knew this, that female age is the number one predictor of reproductive success. So waiting too long can mean a lot of things in the reproductive world. So if you have been trying to conceive for 5 years with the same partner and you guys have not had a single pregnancy, that is waiting way too long. And now the effects of age have potentially taken over and significantly decreased any chance that treatment could be successful. Unfortunately, I do see those scenarios. For women who are, waiting for the right partner before they even consider what it looks like to start trying, oftentimes I say, nobody regrets freezing their eggs, but a lot of women regret not freezing their eggs at all, or not freezing enough eggs, depending on the age of the women to start this process. And so I'm all about reducing that feeling of regret because we just see it so much. And it's really heartbreaking because you can't reverse the effects of age. And it doesn't mean that women in their 40s cannot conceive naturally. It just means that you should understand your options and make informed decisions based on that.
I completely agree to minimize that kind of feeling, because one thing I think people also talk about is that even if you freeze your egg, it's not 100% guaranteed that you're gonna have a baby, but at least you have that option. Otherwise, you don't even have that option.
Exactly. Yeah. I mean, treatments are never a guarantee for anything. I wish it was because it would make my job a lot easier. And my definition of success when it comes to treatment is the less cycles my patients have to do, the better. The more successful I feel about their treatment. But that's not always our reality, right? So
You mentioned to avoid intrusive thoughts. What's a good example of one, and then how could it hinder your fertility outcomes?
So, intrusive thoughts are a big problem when facing infertility and recurrent pregnancy loss, especially. I think it's sort of just a coping mechanism that a lot of people have. It's almost like you're trying to protect yourself by assuming the worst is going to happen. So, an example would be you're going through IVF. This may not have been your first cycle. You may have had a failed treatment in the past and say, it's not going to work this time, or I'm going to end up with all abnormal embryos, or they're going to do the transfer. And then after the transfer, even if I do have a positive pregnancy test, then it's going to lead to a miscarriage. And I'm going to have to go through this whole process all over again. And it's trying to, it's almost like your brain is going down this rabbit hole of worst case scenarios to try to protect your emotions, but the reality is it doesn't lessen the blow if something bad happens. The heartbreak will be there, the grieving will be there. And so I always try to, I know it's easier said than done, but I always try to encourage my patients to, when you have those intrusive thoughts, you need to have active thoughts in response to that, to tell yourself, this is my brain trying to find a coping mechanism for something that I cannot predict. You cannot predict the future. Stop trying to, because all it's doing is it's negatively affecting your mental health without improving outcomes. So, how it could affect your fertility, we don't know. There's all these theories about how stress negatively impacts treatment cycles. Um, you know, saying, oh, just relax, that's not helpful either, because if relaxing worked, then that would make things a lot easier, right?
Yeah.
And it's not necessarily that stress per se causes infertility, but it could certainly negatively affect things if you are chronically stressed, you have elevated cortisol levels. That stress response we know is not good for your overall health, it's not good for reproductive health, mental health, it's all linked. Our body is one, right? So just helping to reduce these things can potentially improve outcomes, but it's very patient dependent. I always tell patients, like, take the whole stress thing with a grain of salt as well, because if stress did not allow us to procreate, then we probably wouldn't survive as a species. So it's probably not it. There's a spectrum.
Yeah.
The more severe, the more intense the stress, the more chronic that it is, the more likely it will affect your health and your reproduction. But in the same token, like some low-grade chronic stress, it may impact it, it may not. It's hard to say. And it's not easy to measure that either.
I love you're giving people tips and then, by making it actionable. So to
Yeah.
counterbalance these intrusive thoughts, and then which kind of lead to my next question is to be more actionable. Because why do you think so many people ignore their symptoms? And then why do you advise against that? I'm assuming that's also have to do with, if you have symptom, you're not addressing it, then you continue to have this intrusive thoughts. They all kind of work together.
Yeah, I think they work together. I think there's two aspects to ignoring symptoms. I think that part of it is cultural. I think as women in general in society, we're always taught to sort of like women experience pain and no pain, no gain. And you just got to suck it up and do the thing. And in many cases, too, we're expected to function in all scenarios. We're expected to come back to work as soon as we have a baby. We're expected to work until the last day of pregnancy. We're expected to work through miscarriage. And it's awful. And so I think that when women, for instance, have really irregular periods, they chalk it up to, well, this is my norm. Or they have really painful periods. They say, well, some women have painful periods. Or they'll even tell, I think the other aspect of it is they will tell someone and they get dismissed. So whether it's their physician or even a loved one where they're like, hey, I think there's something wrong. And they're like, oh, you're fine. This is normal. Sometimes periods are painful, NBD. And so they just learn to suppress and ignore whatever symptoms. And then by the time they come to see someone like us, where, for instance, somebody is finally diagnosed several years later with severe endometriosis that should have been managed for years, it was missed. And it could really, really worsen the outcome of their reproductive health because nothing has been done during that time. So, never ignore your symptoms. If you feel like something is wrong, then try to get to the bottom of it. And even for my endo patients, for instance, when we try to manage their pain, I say, when you come back for your follow-up and I ask you if you're still experiencing pain, don't tell me that it's better to appease me. Be honest, because then we have to troubleshoot and we have to find something else that could work for you. So, and I noticed that it's a very common thing. It's like the people-pleasing aspect to a lot of women where they say, well, my doctor's trying so hard, maybe I'll just say that I feel better because they're nice and they're trying to help me and I don't want to disappoint them. And it's like, no. You got to be honest about your symptoms. This isn't about appeasing anybody but yourself.
Absolutely. What role do plastic play in fertility struggles? Because that's like bubbling up. I mean, we're a big
Yep.
fan of this topic, but since it's in the trends as well, so
Yeah, it's getting a lot more awareness. In our field, we know that environmental toxins, endocrine disrupting chemicals are playing a very huge role in various endocrine pathologies, and it also negatively affects fertility. So, your plastics, for instance, those are filled with things like BPAs, phthalates, all different chemicals that we know bind to receptors, hormone receptors, and they can either shut down the function or mimic the function, both of which we do not want. So, you know, it, for instance, there is a lot of research showing that phthalates negatively affect sperm count and motility. We see that BPAs, which are sort of like they try to mimic estrogens and either act weaker or stronger depending on the organ tissue, depending on the type of receptor it's binding to, because FYI, there are different types of estrogen receptors that elicit different functions in the body. And so these chemicals can really wreak havoc on your fertility. We also know that there are links to different forms of cancer, behavioral problems in children. So there is a myriad of symptoms that we're seeing in association to these environmental toxins. And while we cannot eliminate them, we must work hard to reduce it. But I think that the hardest part about this is a lot of it is invisible, and people have no idea what is in their system unless they're part of some research study or their doctor is well versed in it and testing for it.
yep. Absolutely agree. And another point I also want to add is besides the impact, preconception, pregnancy, but you also actually impact IVF success as well, as you mentioned about the mechanism.
Yeah,
I mean, during IVF, you also need hormones and all need these. So you actually want whatever hormone you're given to be working well.
right.
So you also don't want these extra stuff.
Yeah, we don't want anything interfering. So I would say that there's a lot more reproductive specialists out there who are counseling their patients. Eliminate fragrances as much as you can. So no scented candles, perfumes, all the fragrant laundry detergent, all of that is incredibly toxic. It's causing more harm than people even imagine. And in fact, in our embryology lab, we have a very strict no fragrance policy because they emit volatile organic compounds that could halt embryo development altogether. And it's really, really important. I'll never forget the first time in fellowship, nobody told me this, and I didn't even know this as an OBGYN. And I showed up for my first egg retrieval wearing perfume, and my attending said, No, you don't get to do it now. You cannot wear perfume. I didn't know. Nobody told me. And so I very quickly learned and was taught in fellowship, just no fragrances whatsoever. You cannot have anything perfumed to come in and treat patients.
Oh, wow.
So
Oh.
yeah, so it's really intense. And like this is a pretty universal thing where, especially when it comes to the embryology lab, nobody is allowed to wear anything fragrant for the sake of maximizing survival of of the eggs, sperm, as well as embryo development.
That is amazing. That is amazing. You also mentioned that we don't advocate enough for ourselves. How can we improve that?
Through knowledge. I mean, the more you understand about your condition, about your treatment options, the more you can really advocate for what works for you. If you are not having everything explained to you, uh, sufficiently, then it's really hard to be able to do that. But if you feel like there's something wrong and you just need to have more in-depth conversation about what it means for your diagnosis, what your options are in terms of treatment, in terms of lifestyle. So we always focus on pharmacologic therapy, but there's a lot more to treatment than just that. And a big part of it is lifestyle. So advocating for yourself just means that if there is something that doesn't align with your values, aligns with what your goals are, then you need to speak up. And then also just really understanding, like advocating to learn more and to understand more, because sometimes on Like, I'm all about advocacy, right? Sometimes on the other side of that, some patients don't really understand much and they will fight for very specific treatment protocols because that's what a friend did. And, I try to explain, like, your care is individualized. Whatever your friend did may not work for you. So let's talk about it, make sure you understand all this. And then if you still really feel strongly that you don't want to do this, then, by all means, you have full autonomy. But, advocacy is not just arguing about your treatment for the sake of trying to take control, because at the end of the day, you still have to work with a physician or a provider that really trust enough that can help guide you to make a good decision. So a big part of it is really just educating yourself in order to maximally advocate for what your needs are.
which which is a perfect segue into the ings, and then the first is obviously learning more about fertility. So what are some good resources that you would recommend for people to, start learning more?
Good question. There's a lot of different online places that you can learn more. One of the best places to start, because it's for free and it will help you learn the basic building blocks about reproduction that you need to know, is ASRM.org. So the American Society of Reproductive Medicine has a tab for patients and for professionals, medical professionals. Now you can still access all of the publications for the medical professionals, and I've had patients who learned so much and then they head over to the provider side to read the committee opinions and the practice bulletins, the things that we use that guide some of our practice, which is really impressive when patients are able to do that. But you have to start with the basics. And starting on the patient side, there's just so many FAQs explaining things about different diagnoses, pamphlets, handouts. Great resource. Alternatively, it's always a good idea, if you're seeking care through a fertility clinic, to ask them about additional resources that they can provide. A lot of us doctors, like myself included, I do have my own website with some blog posts, although it's been a little bit on hiatus lately because, life's busy. But there are many resources out there. I know Fertility IQ is another really great one, although I think you do have to pay for membership for that now.
Cool. You mentioned a lifestyle. So what role, I know lifestyle is, nutrition, movement. So what role does movement play in promoting healthy fertility outcomes?
Well, movement in general, exercise is what helps keep you metabolically healthy. And your metabolism is highly linked to your menstrual cycles, and then for the men, to sperm production. Aside from, of course, your overall health, metabolic health is super important. When we see patients with things like insulin resistance or women with high testosterone due to disorders like polycystic ovary syndrome, PCOS, they really need to do exercise in order to improve their metabolic markers, such as their fasting glucose levels, their insulin levels. And insulin really does play a huge role in follicle recruitment. So each follicle contains an egg. So basically, the way that the ovaries function to regulate the menstrual cycle, to ensure that you have ovulation. So, exercise is important for everybody, and it's especially important for women to be doing more specifically weightlifting and building muscle. I think it's like the most underrated thing ever when it comes to lifestyle. Of course, any form of resistance training is great, and if you are getting your exercise in, that's fantastic. But if there isn't any resistance training in your exercise routine, or if you're only lifting weights, only doing resistance training without any form of cardio, then you need to supplement with the other. That's sort of the perfect combination for metabolic health, reproductive health, mental health, overall health, everything.
Everything. And then now let's talk about nutrition. Like, so what are some high level, important nutrients that we should consume to optimize our chance of conception?
So there's a lot of different accounts and books and things out there that will tell you, do the quote unquote fertility diet, do this diet, that diet. Most of the diets that are sort of promoted by physicians have one major thing in common, is that it is focused on whole foods. Okay. Now, if you are vegetarian, that's okay. There are accounts out there that say you should not be vegetarian, you should not be vegan, you should not be eating meat. And I think that everyone's sort of taken sort of a polarized stance on nutrition.
Mhm.
And at the end of the day, different things work better for different individuals. But the primary focus overall should be more plants. You want a combination of all three major macronutrient groups. That's your fats, your
Mhm.
carbs, and your protein. Most women especially are not getting enough protein in their diet, so that needs to be a bigger focus. And we know that ultimately you want to reduce red meat intake. It doesn't mean that you have to eliminate it from your diet. If you are someone who likes red meat, it's okay to eat it once in a while. It just shouldn't be part of every meal every day.
Mhm.
We know that protein sources that come from fish and seafood, that is great. And even if you're not able to afford sort of the high-end seafood that gives you promises that it's tested for microplastics, which ideally we want to avoid microplastics, we still know that seafood benefits outweighs the possible risk of microplastic exposure because they're high in omega-3s, high in antioxidants, and you still want your organic produce, so your vegetables and primarily vegetables, but also fruits to be sort of the main star of the meals.
I love it. I love it. And then also the approach with whole foods that you can be on any diet, but just less processed and then,
Exactly.
eating whole. And that would be the key.
Eating whole, the less that it comes in a plastic container, the better. You know, I realize that I'm very privileged being in Southern California where we have year-round farmers market. So I go every Sunday. I have my, specific farms that I like to shop from because I know that they do not spray with pesticides. That's a really big deal. The glyphosate is a big problem, especially when it comes to our foods. They're sort of in everything. And so just sort of prioritizing getting unsprayed produce, washing it really well, soaking it in water for a long time with some vinegar is the way to go.
Amazing. Amazing. Okay, I have two more questions.
Yeah.
Since you're so knowledgeable and I felt like people need to be working with you. So like how can someone work with you?
Thank you. So, pretty easy actually. If you patients actually people DM me all the time to become a patient. You can also head to HRC or havingbabies.com, where you can request an appointment there, as well as my website. So sashahakman.com is an easy place to find me. And there's like an inquiry tab where you can then submit a request for an appointment. I do a lot of international patients as well. So people can do it through Zoom. It could be for treatment cycles that they plan to fly in for, or it could just be for a second opinion to review records, seeing if there's anything missing, anything that they would like to have added on.
Amazing. I also really love this reviewing second opinion because there are so many different options out there. It's so hard to navigate. And then given
Yeah.
education background, this is so amazing.
Yeah. I mean, sometimes even with really difficult cases that I have, I'll offer my own patients a second opinion. I do think it's really important to do that, especially if you're kind of like, well, is there anything else that I can do? Where I'm like, you know what? It doesn't hurt. If you want to get a second opinion, I will not be offended. And I think that it's not talked about enough as physicians that we should often encourage second opinions. Especially if the other physician is saying, "Hey, like honestly, I agree with everything that's being done. Keep going." Or you know what? Maybe we try this instead and see if that works for you. So it really depends on the situation and what needs to happen for the patient's care.
Amazing. Anything else you'd like to share or promote today?
Um, I mean, the biggest thing is if you are really worried about your toxin levels, I just love that you guys offer a relatively easier way to do this at home without having to look for, a functional doctor who specializes in these things. I know a lot of my colleagues have been using Million Marker as well. And so it's I love the test that you guys offer with sort of actionable things to help fix whatever toxin levels are elevated for patients.
Thank you. We want to be working with more people like you, get people educated and then start taking actions.
Yeah.
So we can get these out of their body and then hopefully they have a better fertility journey
Yeah.
and more successful.
Yes. And prolonged health and life, you know?
Absolutely. Absolutely. Thank you so much for taking the time to join us today. And we'd love to invite you back again to talk more
Sure.
on these topics.
I would love to. I love it.
Thank you. Happy New Year again.
Thank you. Happy New Year. Have a great rest of your day.
Bye. You too.
Bye.